Good afternoon. I'm David Sweat, Deputy Division Director, Shelby County Health Department, and welcome to the City of Memphis Shelby County Joint COVID-19 Task Force press briefing for Tuesday, March the 9th. And starting off with our numbers, we're at 88,949 cases have been reported in Shelby County so far, and there have been in the surrounding counties 6,990 cases reported in Tipton County, Tennessee, 4,694 cases in Fayette County, Tennessee, 19,831 cases reported from DeSoto County in Mississippi, and 5,438 cases reported from Crittenden County, Arkansas. In our area here in Shelby County, we have 1,258 active cases, with 1,527 deaths have been reported so far. And so in the last 24 hours, we reported 41 new cases, but we had no new deaths reported, and we're grateful for that. As far as testing here in Shelby County, we have performed 1,041,739 tests so far in the pandemic, and we've had 9.8% of those tests return positive. For the state of Tennessee, the number of cases that have been reported are 783,904, and we are happy to report that on the vaccine campaign front, we can document now 182,789 doses of COVID-19 vaccine have been administered here in Shelby County. That means 123,681 of our residents have gotten at least one dose, and 59,108 people have been fully vaccinated, receiving 2 doses. So although the vaccine campaign remains a major focus of ours right now, we are also continuing to emphasize the importance of testing. And we are, last weekend we did have a test event that the Shelby County Health Department did an outreach to our Latinx community. We have another one of those coming up this Saturday, March the 13th. I believe we have a graphic about it. It's at Iglesia Bella Vista on Highland Street, and that is from 9 a.m. to noon on Saturday, March 13th. Free testing for anyone age 5 years old and up. 150 tests will be available, so first come, first serve, but please come out and get tested. It is important for us to continue to push testing as part of our, as the first step and one of the most important steps in our response process, because knowing your status is vitally important for taking the steps and measures necessary to isolate, to protect others from being around you when you may be shedding the virus. If you don't know that you're COVID-19 positive, you don't know that you're shedding the virus, then you would not be as careful. Once you know that, you can take precautions. And also, when it comes to finding variant strains, the testing is the necessary step, because without people getting tested using a PCR test, we would not have any material to work with and sequencing to detect variant strains. So it remains a vital, important step in the process for people to go out and get tested, especially if you're having any signs and symptoms of a respiratory illness. And with that, I'm going to turn it over to Chief Doug McGowen, and he'll give us an update on the vaccine campaign.
Thank you, David. And before I get to the vaccines, I'd like to just pick up where David left off with the testing. We know wearing the mask is important, social distancing important, and so too is knowing your status. There really is no reason for anybody that wants a test that they shouldn't be able to get one. There are more than 15,000 available test slots each and every week in Memphis and Shelby County, and so they're easy, they're free, they're available, and they're for you. Especially as we come into this spring season, we know there are families who are planning to perhaps go on a trip for spring break. We know Easter is just a few weeks away, so it's critically important, just as we talked about here before the Christmas holidays, that as we move into the spring break season and Easter season, as families want to gather, that people know your status. David talked about one pop-up testing event that will be at the church this weekend. There will be another on Saturday and Sunday you'll see the graphic there at Poplar Healthcare, which is out on Hacks Cross Road in the East Memphis Hickory Hill area. It goes from 8:30 in the morning till 5:30 in the afternoon. Plenty of tests available. We encourage you to take advantage of that. this Saturday, the 13th, and this Sunday, the 14th. So we'll move now into the vaccinations. David gave you the overview. We've done 182,000 or so here in Shelby County since we began. Just last week, we performed 32,800 vaccinations. That was a combination of both first and second doses. And so going forward, what does the plan look like? We know, based on the state's allocation to us, that we should be able to maintain a pace of between 32,000 and 34,000 vaccinations each and every week for about the next 4 weeks. So before Easter, we should have about another 130,000 folks vaccinated with first and second doses. I wanted to share some information about how vaccinations are delivered because I think folks need to know there's more than just one way. First is through our fixed site pods. You all are aware we have fixed site pods that are established in the Raleigh area, one that is in Whitehaven, one that's at the fairgrounds at the Pipkin building, and one that is at Appling Cove, just off of I-40, and then one that is out east in the Germantown-Collierville area. Those are strategically positioned, to be along lines of communication, transit lines, easy to get through, or easy to get to, and high throughput areas, so we have the broadest availability across the city and the county. And all of those are doing about 1,000 vaccinations a day at minimum. But also our hospital systems have been key to delivering vaccinations. To date, they've done about 65,000 vaccinations just through our hospital systems alone, which is a pretty good percentage of the vaccinations we've delivered here in Memphis and Shelby County. One of the things that is less well known is that there are more than 100 agencies and partners who are eligible to receive vaccine and then to administer that vaccine to people who are their clients. And that includes some pharmacies that we have here. That includes some of our clinics, or FQHCs as we call them, like Christ Community, Church Health. There are others like Tri-State Health Systems and Memphis Healthcare. And they have locations in South Memphis, Hickory Hill, Fraser, Raleigh, Parkway Village, South 3rd Street. There are others, but in literally every neighborhood in our city, we have a provider who has vaccines. We see that number growing, and we see their capability to deliver more vaccines growing over time as well. As we bring on more agencies, more availability is clearly going to come to each and every neighborhood and all throughout the entire county. We work each and every week to try to allocate doses so they're equitably spread across the county and across all of those agencies. And what you will see is a more normalization of the vaccines. Today, as you know, you can go to the Walmart pharmacy and get a vaccination. Tomorrow you'll be able to go to any pharmacy, your doctor's office, but that's still a few months away. But that's the direction that we're working towards. The final way that we are delivering vaccinations is through what we're calling pop-up pods. We have the 5 fixed sites, but 3 times a week we're going to host a pop-up pod. And we're calling them pop-ups because they may not stay in any one particular site. But we will evaluate each and every Wednesday the data, and David helps produce this data based on zip code and demographics of population who are taking the vaccination. We will evaluate that data, and then we will work with the partners who have come forward saying they would like to host a pod. We'll look at the data and say, where should we put that pod so that we can meet the areas where people are having less uptake of the vaccination. In other words, what part of town has the lowest percentage of vaccination, and that's where we should prioritize that pop-up pod to make sure that people can take advantage of the vaccine. The very final way that we have not yet begun but will as early as next week is how do we get to the homebound and homeless populations. Our teams are working together, the Shelby County Office of Community Services together with Housing and Community Development and the Memphis Fire Department to establish a homebound vaccination process as well as a homeless vaccination process so that we can get to those populations as well. People who are challenged with transportation, people who are hard to reach, to make sure that we have vaccinations available to everyone. And so with that, I'll stop and take any questions that you may have.
Fred Broders, Local 24.
Thanks. Good afternoon, Doug. Perfect segue to what you were just sort of wrapping up with. I know you kind of talked about the next 3 weeks, 32 to 34,000. Is there an estimate on when Shelby County could realistically administer up to or around 50,000 doses a week, and how might Johnson & Johnson play into that? And I have a follow-up.
Sure. Well, we can only we can only administer the number of doses that we receive from the Tennessee Department of Health. That is our forecast allocation, although I will tell you that by later today or tomorrow, the federal government may change the allocation to the state of Tennessee, and as soon as they are made aware of that change, they will let us know when we could anticipate an increase. Last week, we allocated about 20,200 doses. We should be receiving those from the state either today or tomorrow. Next week, we're planning to receive another 20,200 doses, and that's the first doses. The second doses automatically follow, so that's why we have more appointments than we actually have the doses coming in. Those are first doses. So we'll know soon. The J&J vaccine, we've only received several hundred of those doses here. Largely, they went to one of our hospital providers for a very specific set of individuals who are in critical need of that kind of a vaccine. But we'll know more when that J&J becomes more widely available in the state of Tennessee. Your follow-up?
Thanks, Doug. And as a follow-up, I noticed in the data yesterday from Monday from the city of Memphis, there are some sites, Germantown and Pipkin, where there's large fluctuations in the number of appointments versus administered doses, over or under, kind of vice versa. Is there any kind of update in the last week about more people with cancellations of appointments, vax queue playing into that, any kind of update on sort of making sure that the numbers can match as best they can?
Sure. So it is a bit of a moving target. It's a good question, Brad. So what happened earlier this week was, as you recall, this would be 3 weeks out from the snowstorm week when people would be expected to receive their second dose. Also during that, there was a transition between Shelby County and the city of Memphis with the responsibility for distributing those doses out. There was the expectation that there would be a good number of folks with second dose appointments during this week. So we scheduled those second dose appointments. When it became apparent that the uptake of those second doses was not happening, we pivoted and changed many of those over to the first dose vaccine. Specifically, we had 3,600 doses of Moderna that we knew people were ready for their second doses. We only had about 1,400 people sign up to take those second dose Modernas for whatever reason, and we're still not sure exactly what that reason is. So we still have some additional second dose Moderna. But what we didn't want to do was leave those appointments completely unfilled while we had staff on hand, and we knew there were more people that needed their first vaccine. So we consolidated those 1,400 appointments. We opened up new first appointments at Pipkin Building and several other sites, and those were backfilled. So in some cases, you'll see more doses administered than there were appointments, and that's an artifact of the fact that we didn't really capture those new first dose appointments. The bottom line is we put that many shots into arms. The second part of your question was, there are some sites where we know people were supposed to take first, where people set up in the appointment system to take first doses or second doses and then simply did not show up. We are working our level best to email people reminders, to send out broadcasts that say, please show up for your appointment. We think as we transition to the state system, which we anticipate will be next week when you set up your first and second dose appointment at the same time, that we'll have better compliance with that second dose show rate.
Laura Testino, Commercial Appeal.
Hi. Yeah, I wanted to ask today about vaccine hesitancy. Is any of these lack of appointments or not scheduling second doses or not showing, is there a concern of vaccine hesitancy in Shelby County? And then have a follow-up question.
Sure. Well, I think we've all talked about that. I can't point to a specific proof point that says the reason that somebody didn't show up was because of vaccine hesitancy. I think we all understand that's a phenomenon that we are facing. We think through communications, through trusted partners that can share the message about how important vaccinations are, is the way that we get over that hurdle. So we have just taken it on as an assumed fact that there will be some vaccine hesitancy, and then moved forward with a communication plan and bringing on partners that can be seen as trusted partners to deliver that message so that people get over their vaccine hesitancy.
Great. And I guess kind of segue to the follow-up then, could you describe a little bit more just what the plans are, as we're getting, significant more doses per population here in the coming weeks, which is great. Won't be necessarily the best if there's not still the demand that we've seen over the past few weeks. So what is the city, I guess, and any kind of county plans to work with partners as far as awareness campaigns go?
Sure. Well, I think there's a significant amount. There will be some advertisements that you'll see in every single media. There is a social media aspect of that. We've reached out to the clergy to ask them to also share the message. Part of our strategy with the pop-up pods is to partner with, as we have done several times in the recent past, as recently as last week and the week before, to partner with some of the churches in the neighborhoods, and we've had really good turnout because of that. So we really have to hit it from every angle. It has to be multilingual, it has to be personalized, and it has to be brought home to that specific neighborhood, and we need people at every strata to be leaders, to stand up to say, I got mine, won't you please get yours? So there is a multi-level strategy there, from communications to trusted partners to partnering with agencies and organizations that people trust and identify with. We believe that there is still significant demand. We are still early in the phases. As you know, we just recently moved to 1C, and that's people with comorbidities. There is a heck of a lot of the population still to come, and so I think that we will see a pickup in the number of people that are scheduling appointments. As soon as we opened new first dose appointments, they were almost immediately filled. So that shows to me that there is still significant demand in the community.
Dominique Dillon, Fox 13.
Hello. So yesterday, the CDC released recommendations for vaccinated people, but they didn't touch on travel. What recommendations do you have for people who are fully vaccinated and would like to travel, and then also maybe even people who aren't fully vaccinated?
Okay, I'll let David handle that if you have any suggestions about that, David. I know that is of concern to people, so David?
Thank you for the question. And so right now, the new guidelines from the CDC really focus on what can people do more safely now that if they have been fully vaccinated, means they've had both of their doses. And right now, the real focus of that is a couple of areas. First, if you're a fully vaccinated individual, then you are able to also get together with other people who are also fully vaccinated for a small group gathering, like a dinner party, or to hang out in an indoor setting with other people who are fully vaccinated. You are fully vaccinated, and people in those settings are no longer, even if they don't live in the same household, no longer recommended or required to wear a mask. The other nuance there is if most of the people in the gathering are fully vaccinated, but there's a single individual who's low risk and unvaccinated, you can still be in that environment together unmasked. But in terms of out in public, that's people who are vaccinated are still recommended to be wearing a mask at all times out in public, and also in larger gatherings. Now, the other benefit, though, that an individual who's been vaccinated or fully vaccinated can have is that if they get exposed to an individual who has COVID-19 disease, but they're fully vaccinated, well, then you don't have to be tested, and you also don't have to quarantine any longer. So those are the major bullet points that came out of the new CDC guidance. I think that is an improvement for people in terms of living a slightly more normal life, right? But what is not yet recommended or addressed is the idea that if you're fully vaccinated, you can do whatever you want to, or travel freely and all that. That is not part of what those bullet points from the CDC guidelines yesterday are promoting. So it is a step of progress, though, that you could get together. Examples: if grandma has not seen her grandchildren for a year, but the adults are all fully vaccinated, she's fully vaccinated, and you want to get together and everybody's healthy, nobody's sick, then you go ahead and do it, right? That's the kind of opportunity that's being opened up by these new guidelines. And if I can, before you ask your follow-up, I'd like to go back to something that Doug mentioned. We have moved to a new phase, and that phase 1C, I'm not sure everybody fully understands what that means, so let's emphasize it one more time, that if you are 16 years of age or older, and you have any number of underlying health conditions, so that could be diabetes, it could be asthma, it could be hypertension, you take high blood pressure medicine, a number of other things, you can go ahead and get scheduled and get your first dose of vaccine if you're over 16 years of age. So we've been restricting in previous weeks or prioritizing that people above certain age thresholds need to be, we need to vaccinate those folks first. But now, if you have any of those underlying conditions and you're an adult of any age, just call 222-SHOT, go online and self-serve, make a vaccine appointment. It's very easy to do, and the process flows very smoothly. So would want to encourage people to go ahead and make appointments.
And just as a follow-up, overall, there are going to be some people who travel anyways. What advice would you give them?
Whenever you're in public, whenever you're in transit, on an airplane, on a bus, on a train, you've got to wear a mask at all times. Whenever you're in gatherings or out in the world going shopping, you need to wear a mask at all times. And for folks in Shelby County who might choose to be traveling to some of the states who have eliminated their mask mandates, I would say it doesn't matter. While you're there, wear your mask. In the state of Texas, in the state of Florida, in the state of Mississippi, whatever, because it's the best thing you can do.
Kelly Roberts, WMC.
Good afternoon. I wanted to just get some clarity on the pop-up location, since there was a bit of discussion about that today. I see on the website, the COVID-19 city website, that there is a sign up for second doses at the Commodity Supplemental Food Center. And I know when they started administering doses there, it was solely for those people who used that service. As you decide these pop-up locations, will they be publicly advertised to sign up for? Are you going to try to contain it in a way that, only people of a certain neighborhood can really take advantage, that those people that you're trying to target are able to get those appointments first?
Sure, that's the intention, is so that we put that in the neighborhood where we see the benefit, right? So that's what we're trying to do. Commodities, we treat it as a pop-up, and the reason we mentioned it as a pop-up was because it was not a fixed site that was open 5 or 6 days a week. Just to backtrack a little bit on our capacity to deliver and source these, we have 5 fixed sites, and our limitation is really the ability to source about 6 or 7 sites a day at the most, and 7 is a real stretch. So we try to keep it at 6 sites a day, so 5 fixed sites and 1 pop-up site. The idea behind the pop-up is exactly what you said. If we are going to zip code 38126, we want the folks in 38126 to take advantage of that. And very likely what we're doing is partnering with an agency, organization, or church who believes that they have an affinity group and they have a relationship there that they are going to be able to fill up 500 or 1,000 slots on that day. So it's likely we will not have a set schedule for those appointments unless it is a City of Memphis publicly run site. If it is an affinity group, if it is a church, if it is an organization, we will largely allow them to do the marketing and advertising to draw the people from the area that we are trying to target.
Great, thank you so much. And this is kind of a clarification question too. I know that yesterday some second dose Moderna appointments were switched to also be first or second dose. So are you guys looking at the low demand for those second dose Moderna appointments that were open up? Do you believe that people aren't getting their second doses, or, among the switch of distribution hands and that sort of thing, that maybe they found somewhere else to get that second dose?
Well, just a point of clarification. The only switch that occurred yesterday was we had 3,600 second dose Moderna set for Monday, Tuesday, and Wednesday of this week. Since we only had a small number of people take us up on that, we shifted the location where we were delivering those Moderna doses to the Avery site, which is the MFD headquarters site over on Avery, so that we could open up new first dose appointments for Pfizer. So we didn't open up new first dose Moderna, we just moved the location of those second dose. Now, your point is valid. The question remains why people did not take those second dose Moderna. We'll continue the evaluation. We are seeing the second dose Moderna trickle in. And so I would submit that there are likely people that still need that second dose. There's a system called Tennis. We're in the process of doing a query of that system so that we can determine how many people we believe remain to have that. But the other point you made is also pertinent for some groups of people. They may have chosen to take that second dose at another location, another county, another state. Quite frankly, they can't be turned away because it is a federally funded vaccine. So people may have chosen another means of delivery to get their second dose. That remains to be seen.
Jane Roberts, Daily Memphian.
Doug, I think this is a question best for you. You mentioned that Tennessee possibly will be getting a larger allocation. Will lots of states be getting more vaccine, or is it just a few states?
No, sure. Everybody should be getting more vaccine because we are getting our fair share as a state, and then we as a county within the state of Tennessee are getting our fair share from that. So as you know, originally the target was late summer for all of the vaccines for all adult Americans to receive it. Recently, President Biden has said that he would like that to be in May, which means there's a necessary ramp up of production, which will necessarily mean more supply coming to us earlier than we expected. Certainly, we would never meet a May or June deadline at our current pace of vaccinations of doing 30 to 40,000 every week. We need to be in the 40 to 50,000 or even higher in order to meet, especially the sooner the deadline gets here, the more we have to do each and every week. So again, just to reiterate, today we're receiving about 20,200 first doses every week. I anticipate that number will creep up over the next few weeks, and there will come a time, I anticipate, where we'll have a substantial bump in that number. We're working to make sure we're prepared to take that on, and we're confident with the ecosystem of people we have and systems and organizations here that we'll be able to absorb that increase in vaccinations.
Jane, was there a follow-up?
No, thanks so much.
Adrian Sands, AP.
Hello, can you hear me?
Yes.
Okay, thanks. With 41 new cases today, I was curious. I tried to look really quickly on a couple of websites, but when was the last time we had that low number of new cases reported? In the daily updates, and if it's if we're seeing a trend, a downward trend, which I think we are, what would be some reasons for that?
Sure, I'll turn that over to David for that analysis.
Thank you, Adrian, for the question. As far as when was the last time we had numbers that low, it would have been a couple of weeks ago, 3 weeks ago during the winter storm, when obviously testing got disrupted, and so we had a few days where it was very low numbers of cases. But on Monday, because we're having a 1 to 2 day turnaround time with the laboratories, data that comes in on Monday represents largely people who got tested on either Saturday or Sunday, and we know that the weekends throughout the pandemic has always been a lower period of time for numbers of people to go out and get tested. So what we're seeing is about 4.3% positivity rate, but we do tend to see a spike in the numbers of people who go out to be tested on Monday, Tuesday, and Wednesday. And then as we get closer to the weekend, the numbers of people per day who choose to get tested goes down, and then Saturday and Sunday it's at its lowest. So the fluctuation that we saw yesterday with 41 new cases being reported most likely represents fewer people got tested on the weekend.
Thank you.
We are out of time. Are there any closing messages?
No, just as far as closing messages, just it's vitally important we continue to wear these masks. And it's vitally important that people come, make an appointment, keep their appointment, and come out and get vaccinated. Doug, do you have any further? Yeah.
Can't say it enough. Wear the mask, stay socially distanced when you're in public. Take advantage, if you guys could call up the sites again for this weekend of the surge testing to know your status. I just want to emphasize something David said earlier. It's critically important. The only way we can keep these variants at bay is to identify them and isolate them, and testing is the key. So go on out to Hacks Cross on Saturday or Sunday, go over to Highland Avenue on Saturday at the church there, and please take advantage of the testing. And then again, share the word. There are lots of vaccine appointments available, still some available this week for first dose appointments. There will be about 32,000 new appointments available next week, and the week after that, and the week after that. We don't want you to wait. We want you to get on board, get your vaccine. Call 222-SHOT if you don't have access to the internet. Know that we'll be transitioning to a new appointment system and a new call system as of next week. Wait times are down. On average, over the last 2 weeks, wait times have been 14 minutes at all the drive-through centers. That's all of the centers all day average 14 minutes. Today it's down to about 13 minutes. So we promise to make it as convenient, painless, and as easy for you as possible. So come on out and get your vaccination. Be a part of the 130,000 people that get their vaccination over the next few weeks so we can go a long way towards reaching our goal this summer. Thank you all, and we'll talk to you on Friday.
Thanks, everyone.